Today we're going to cover automatic exposure control. Automatic exposure control allows the radiographer to set the MA, KVP, SID, and then the X-ray machine determines the length of exposure necessary. It is known for consistency and requires precise positioning. There are two types of AEC devices. Phototimers are now obsolete, but they were located under the cassette, under the table. Ionization chambers are now the predominant used, located under the table, above the bucky, and above the cassette. These diagrams provide an example of the ionization chamber and its location. Ionization chambers provide diagnostic quality exposures for the structures that are positioned directly over the ionization chamber. Selection of the chamber and positioning of the anatomy over the selected chamber are critical. The typical design is one center chamber with two chambers slightly above and offset to each side, similar to eyes and nose on a face. In order to determine which chamber or chambers to select, it's important to know the size, shape, and location of the part to be imaged. If only using one chamber, place the center of the part over that one chamber. If using all three chambers, the entire part should be centered over all three chambers. You can use one, two, or all three chambers simultaneously. It is important to ensure that the chamber that you would like to use is activated. When more than one chamber is selected, the anatomy from two or three chambers is averaged together. Here are some examples of how to select the chambers for various anatomy. When imaging a pelvis, all three chambers should be utilized. When imaging a skull, the center chamber can be utilized. For doing a PA chest, the two outer cells can be utilized. An AP hip can use just the center cell. A lateral lumbar could be just the center cell, and an AP abdomen would use all three chambers. Density controls vary by the manufacturer. They may be in increments of -1, -2, normal or N, +1, +2, or some other form such as percentage, such as +50% and -50%. This will allow the length of the exposure to be adjusted for an increase or decrease in density when using automatic exposure control. The purpose of the AEC device is to maintain density, so we will talk about various changes that have an effect on the AEC. For example, as MA increases, the length of exposure will decrease. As KVP increases, the length of the exposure will decrease. As SID increases, the length of exposure will increase. And as density setting increases, the length of the exposure increases. The only way to adjust density when using the automatic exposure control device is with the density setting. Any other change will be predicted by the AEC device, and it will adjust the length of exposure to maintain density. As mentioned before, positioning of anatomy over the ionization chamber is critical. AEC cannot be used if a metal artifact is suspected, such as a total joint replacement or spinal hardware. Collimation may interfere with the length of exposure due to collimating the beam from the selected chamber. Full field collimation will increase the amount of scatter produced, which will then be detected by the AEC as density. The minimum response time is the length of time necessary for the AEC to respond to ionization and terminate the exposure. The backup time is the maximum exposure time in order to prevent overexposure or tube overload. Anatomically programmed radiography, also known as APR, combines with automatic exposure control to allow for pre-programmed anatomical controls. The area of interest is selected, and then the system determines which AEC cell or cells are to be used. In summary, automatic exposure control can be used to increase consistency, accuracy, and quality. If it is not used appropriately, it can cause repeats due to improper positioning, improper selection of chambers, and artifacts.